11B, low back pain. I'm going to start by talking about my story of back pain. Uh, Hopefully, you can learn from my mistakes. So this all happened in 2012. I was 40 at the time, and what happened was that I put my son in a shopping cart, and as I put him in the shopping cart, my arms were extended. He was probably about 5 years old, probably weighed about 50 pounds. I felt something give. And you need to keep in mind that when you're working with people, they may come in with a story like this, and there's a lot of holes to that story to figure out what's actually going on. So, part of my discussion with you and talking about what happened to me is to kind of take you through the thought process and realize the things going on with people and how you kind of work through it. And I'll use myself as the example there. So I did that, and it hurt. I felt something was definitely not right. I did the shopping, went home, and things didn't feel right, but they weren't horrible for about a week. And then at the end of that week, I was sitting on my phone, playing a game, and my back just something happened there. Again, we don't know for sure what, but I was in an immense amount of pain. I mean, it was bad. Uh, so I went to the doc in the box, the urgent care. This was around Memorial Day, and I was going to a conference. I didn't know if I should go or not, so I went to the doc in the box. They completely misdiagnosed what was wrong with me. Uh, so I went on my trip. I had some issues. I had some issues where my foot was kind of numb and what would be called drop foot. Uh, and then I came back to Chattanooga, went to see my general practitioner. The general practitioner said, well, it's probably a herniated disc, so I recommend that you go to physical therapy. Let's do that before imaging, because probably that's what the imaging is going to tell us that we need to do for you anyway. So I went and did physical therapy for about 6 weeks. I also had a neighbor that was a physical therapist. She recommended exercises that were associated with a herniated disc. I did those exercises. Those exercises, in my case, did not help. In fact, they made things worse. What they said and they told me was, don't, if you feel pain, you shouldn't do this exercise. And in my head, I had to have some level of control. I had pain, and I felt like I just needed to work through the pain. The reality of it is that if you're post-surgery, you may have pain associated with physical therapy. But if you're not post-surgical, you really shouldn't have pain in most instances, or it should be very controlled levels of discomfort and pain. And you should work with your physical therapist to figure out, okay, is this reasonable or not, or not. So I went through that, and they couldn't figure out anything. I was no better after the physical therapy, even though I worked fairly hard at the physical therapy. And then I went to a back specialist in town. The back specialist did some x-rays, and what they figured out was that I had a condition which is called spondylosis. The spondylosis became spondylolisthesis. The spondylosis is a stress fracture in the spine, and based on the bone spurs that they saw in the x-ray, they figured it was probably about 20 years ago that this stress fracture probably occurred. I figure it was probably a result of strength training. Now I don't know that for sure, but that's kind of my guess, is that strength training was done with poor form. This condition is caused by hyperextension of the back. So you have the gymnasts that get this, football players, linemen get this, and when you see those contortionists, I wouldn't be surprised if they ended up with this condition as well. It goes along with that I had back pain for the past 20 years. I thought that was normal, and it wasn't normal. But that's what you see with these individuals, is that it's normal for them. They don't realize that there's something significantly wrong with them. What we kind of surmised that happened was that as that vertebra slipped forward, it actually went and hit my femoral nerve. and it would cause my quadricep to just spasm. It would spasm as I was going to bed. It would spasm as I was asleep, or at least I kind of assumed that it was spasming. And eventually, it kind of got paralyzed, and I lost quite a bit of strength in that quad at the time. And unfortunately, because of the way I handled things, I do have a level of nerve damage still associated with that with that quad. I don't have as much strength in that quad, and I will get cramping from time to time if I'm in certain positions, and I contract my leg. It'll cause the leg to cramp, which is no fun at all. But the key here, and the reason why I bring up this story is, one, doing things with poor form. You may be fine at the time, but it may rear its ugly head later in life. 40 is, yeah, it seems far away for you. I get it, but it will be here before you know it. And I hope to live to 80, hopefully beyond. I hate the fact that for half my life, I'm gonna have this spinal fusion, which is finally the way that they fixed the problem. They fused the two vertebrae. In my case, it was L3 and L4, and that fixed the problem. It took the vertebra off of the nerve, and I recovered after that. But you don't want to do that to people. The fact of the matter is as a 20-year-old, you might be causing problems to yourself, but it's not devastating problems. So you just go on with it. But having good form and watching for your core and watching for your low back care is very, very important. And you might not realize how important it is until much later in life. So with these PowerPoints, I give you that backstory. The materials here, you should kind of consider this. It's designed to prevent low back pain, not treat low back pain. So for the treatment of low back pain, you should see a healthcare professional, physical therapist, orthopedic, neurosurgeon, somebody that can do a surgery to fix your back. Usually surgery is the last thing that we go to. If you go to a good surgeon, they should only want to do surgery on you if you really, really need it. So you don't take surgery lightly. The surgery that I had was pretty brutal. It was not fun. It fixed me. It helped me. So I'm grateful for it. But it's not something to be done lightly. You could go to other healthcare professionals, nurse practitioners, general physicians. They'll guide you to the appropriate healthcare professional, which is really going to be a spinal specialist and or a physical therapist. You could go to a chiropractor. In my case, I was afraid to go to the chiropractor. I was afraid that bone would hit the nerve and cause irreparable damage to the nerve, which may or may not have happened. So I'll be honest with you, I was just scared to go to the chiropractor at that point. So other people report having good outcomes from a chiropractor. I'm not going to say that you should or shouldn't go, but you should definitely use discretion in those instances. And you can, what you can do as an exercise physiologist is you can continue to implement an exercise or stretching program that a physical therapist has initiated. So you keep those exercises going. You could either do those exercises on a preventative basis, or if it's a post event, then you could continue to do exercises that have already been recommended. There's no best way to prevent and rehabilitate low back injuries. I mean, my case was a good example of that. The exercises that work for most people, which is usually hyperextension, the yoga, I guess it's the cobra pose. Those things are very good and help a lot of people, especially if they have a herniated disc. In my case, they caused the bone to hit the nerve, and it was causing more damage to that nerve. So you have to be careful. You can do certain basic things, and in my case, if I was more in tune with my pain, I could continue to do things like planks, but anything that was initiating pain, I needed to not do. And I did a fair amount that caused me pain, which just kind of makes me feel real stupid in retrospect. The focus of most programs are to focus on spinal alignment and lumbar stability. The lumbar stability is going to be really the muscles within your hips. We don't necessarily think of the muscles in the hips associated with the low back, but they really have a significant impact on the low back. A PT-based therapeutic program will help with certain back conditions, but that, as I said, that could hurt other conditions. So you definitely need to be careful, and this is where being in tune with pain is just critical. Improving range of motion, strengthening, stretching, hip flexors, hamstring, low back extensors. We talk about the core, definitely for the hips and the low back, working on that core, working on those muscles. And just think about, you took biomechanics, you took anatomy and physiology, and when we talk about the legs, what muscles do we talk about the legs? We usually talk about the quadriceps, and we talk about the hamstring, as a group of muscles. But when you look at the leg muscles or the muscles of the hip, there's so many muscles that are involved there. So we need to make sure that we engage those muscles as much as possible. And that's going to help create a more stable environment for the low back, for the hips. You also have the abdominal muscles that you want to strengthen. That's what we typically think of with low back exercises or core exercises, but really, core is a whole lot more than just abdominal muscles. If you state for core on your exercise prescription case studies that I'm going to have them do ab exercises, then I can't stand that. Make sure you incorporate the correct muscle groups when you say that. Yes, abdominal muscles will be included in that, but it's not ab exercises. It's core strengthening exercises. Then you have to list the different muscle groups or the different exercises that you plan on doing to address the core. And again, we don't talk about the adductors and abductors nearly as much as we should. And I question how much we really train those, or how much a lot of people train those in a traditional strength training leg program. So make sure that those things are incorporated. Some programs include exercises to increase strength and endurance of both the abdominal and low back extensors. Those are good. But strengthening the low back, I would do a lot of strengthening exercises, things like deadlifts and good mornings and things like that. They're not really necessarily decreasing your risk of low back injury. And I did a fair number of those types of exercises. So doing the planks, doing the isometric exercises are much more important than necessarily strengthening those muscles. Strengthening abs requires that you maximize abdominal muscle activation while minimizing compression load of the vertebrae. So make sure you have a neutral spine when you do your abdominal exercises. And that's really what a key when you're doing those. Muscular endurance is more protective. This is what I mentioned earlier. Lumbar mobility is directly related to low back injury. So if you have more mobility, more movement within your lumbar area, that's not necessarily a good thing. Now, if you're a gymnast and you're working on that flexibility, then all the muscles that are supporting that should be strong. If the muscles are weak, that will also increase the mobility within the lumbar region. So this is one of those things which I've mentioned in different instances before. You need to kind of think about what's trying to be said, what's being said here. To be flexible is generally considered to be a good thing, and it's something that we should recommend. But we want to have some strength around there, and if you don't have the strength, then you'll end up with mobility that's just kind of going haphazard, and that's going to cause problems. Some alternative approaches to low back care to brace the lumbar spine during activity by isometrically contracting the abdominal wall and low back muscles. Also to incorporate the transverse abdominis. So what they'll say is to suck your gut in and then contract as well as breathe diaphragmatically. Those are the way you kind of keep that neutral spine. So you make sure that nobody really teaches you how to stand, and working on standing properly is definitely important. And then trying to incorporate that into your movement when you're doing strength training as well as different sport activities as well. Avoid fully flexed or extended range of motion positions of the trunk while lifting or exercising. Perform exercise, emphasize endurance over strength. And also, what I've added for this, for low back care as well, is working on contrarotational core. That's going to increase the strength of the muscles that support and resist rotational movements typically associated with many sport. Again, this book, it annoys me a little bit, is that they're dealing more with the older individual. When when I was in college for that one semester, freshman year, I did some taekwondo. Taekwondo was very bad for me. If you start as a small child, everything's developing equally. But I had done a lot of resistance exercise, so I was strong, but my core was weak. So I would do ballistic movements, I would do twisting exercises and things like that, and it definitely caused me a significant amount of pain. I did it for a semester. I ended up getting sick later, and then I just never went back to. I never went back to it, which was probably a good thing for me. Again, Taekwondo and different martial arts, they're good exercises, but the way I was doing it was not good for me because they weren't developing equally. So now I was able to create a lot of momentum. I was able to create a lot of force, but I didn't have my core strong enough to be able to counteract all those forces. So a lot of the exercises or some of the movements where this becomes an issue is your golf swing, tennis, baseball swing, anytime where you throw the ball. To create a lot of momentum, it all generates from the hips. You start with the hips, and then everything else kind of follows. And when you evaluate those types of movements, they're basically the same movement. The difference is where your arm is in reference to the rest of your body. So with golf, your arms are low. With baseball or with tennis, your arms are kind of at the belly level, and you start low. It depends on how you swing, but you can start at different places. But as you follow through, it's kind of at the belly level. With baseball, your arms start up high, and then you follow through at the belly level. Throwing definitely starts from a higher position than some of the other things. So when you look at these different activities, and there's a lot of different activities you could evaluate, some of the basic movement patterns are going to be the same. And it starts from the hips and then kind of goes to the hand. And the hand ends up, and the arm ends up being more like a whip that really generates the force, which is great, and you can learn how to do that, and that's where the neuro component comes in. But you also want to be exercising these contrarotational muscles of the hips, or rather the spine. So it's the contrarotational. It's going to be standing with your shoulders and your hips square to the object, so as they are compared to you right now, and then you're bringing your arms across your body. Now, if you have a weight, typically it helps to do this with a cable crossover or with some sort of resistance of the arms. When you do the actual swing, you're going to be rotating through. But when you're doing these exercises, it's like a chop, and you could do this on one leg, or rather in a kneeling position. That creates a more unstable environment, makes it more difficult. But the key is that you're trying to strengthen the muscles that resist the rotation, so that when you're doing the rotation, those muscles will keep your back and everything in alignment the way that they should, and that's going to be pretty darn important when you're doing these exercises. It'll help you do the movement better. It'll help you do better at swinging and things like that, throwing, sport-specific movement. But it'll also decrease the risk of injury, which is also going to be very important as well. So I think